the month, October is really the month of more of the breast cancer awareness, we get to see that in parts of the world where they created a lot of awareness, there were a lot of the people who were running to the doctors and
حالتك نبه تعليق ما علق أثناء المقابلة وهي أنا ما حعلق.
Breast cancer or something as such. So
Yes.
it leads to some chaos as well in parts of the world. Now people, as they read about even urinary tract infections and things like that, a lot of the people start to monitor even the color of their own urine, and a lot of the times they say that you should as well.
بعدين العالم
Just feel any difference in color or difference in pattern, and you would get to see sometimes that they overreact to situations. Is there any good in looking at one's own urine and to actually try to analyze or to think about going to a doctor in advance before feeling any signs or symptoms?
No problem. You can, let's say, take this as a guide, but put in your mind, if you drink plenty of water, the urine will be somehow very close to the water. And if you wake up from sleeping and try to urinate, it will be so concentrated at the night, and it will be, let's say, a little bit dark. If you put this in this mind, you will consider that, and you don't have any other symptoms. This is one of the points. But if you have something, if you saw your urine like cola color, like tea, has, let's say, abnormal smell, this is something you cannot ignore it, just like this. But mild changing in the color of the urine with the same smell, means nothing.
Indeed. And what if you get to, let's say for some of the people, as we're trying to create more awareness, if they get to see any foreign bodies which are not supposed to be necessarily part of the urine?
With the urine?
Yes.
Sometimes you will find this if the patient has a lot of, let's say, urinary stones. For the urinary stones, the thing will, let's say, the factors will increase it if you drink less amount of water. But unfortunately for some people, they have something genetic. They have some, let's say, something in their body concentrates some material which is toxic and, let's say, if you will see any foreign body or any, the urine of the culture sometimes will be dark a little bit, but it's like pure, nothing concentrated in some point. If you find something like this or blood, you must investigate, even if you don't have any other symptoms.
Indeed. So pretty much like Dr. Osama was saying, for the dear viewers, please be aware of any changes in your body. This is one of the biggest concerns that many doctors, they ask us, like, do you see some changes? I'm not sure. So I'm sure when you have patients, I'm very observant. I see this,